Okay, so it's good now. How long you been here?
In this office?
Yeah, in this location.
September.
September? Mm-hmm. What made you want to, like, move here? Because before, you were my physical therapist. For those who don't know, I was in physical therapy while I was pregnant. My back was hurting. My sciatica was kicking up.
I remember.
At 29 and at 30. And I was there weekly with you. So you was giving me the comfort measures I needed.
Oh.
You got me through my pregnancy because I was in pain. I was crying. So you weren't virtual before. This is where I used to go.
Yes. So it was completely by accident. I'm not going to even lie to you. With COVID, I just started to learn how much Black people were undervalued.
Right.
Not that I didn't know before, but it was just highlighted so much more in the past year. And so I was like, okay, I got to start doing things for my people. Mm-hmm. Not to say that all other people groups don't matter, but I just know who I represent and who I care about. So I started to do online education. So I started with social media, started educating people, and then people wanted to see me. And I was like,
like, oh, you want to see my face?
Yeah, like, so you actually want treatment from me. Because, you know, there's a lot of things on social media, people do it for likes, and that's the end of it. And I was like, but if I'm going to do it, I want to do it all. Right? Not only am I going to educate you, but I want to change your entire life. The way I know I do at my regular job, day to day. So I took that leap of faith. I opened up my practice, and here it is.
Okay.
I'm doing it.
Black-owned practice. It's so funny because I know when I would have my sessions with you, we always talked about the importance of people of color, but in particularly Black people, having access to proper health care. And we knew how scarce that was. And we knew it was just as scarce as the lack of Black healthcare professionals being in this line of business.
Yep.
And so I found out recently that Black people only make up 4% of the healthcare professional population. And that's a very tiny amount.
Right.
And a lot of times the reason why I feel like now more African Americans in America, the Latinx population in America, we are searching for familiar faces when we walk into the healthcare industry.
It matters.
It does. When we walk into the doctor's office, we're searching for doctors that look like us. And a lot of times, when we don't, I wouldn't say we get discouraged, but we do get a little weary. Like, okay, well, there's someone that looks like me that can help attend to my needs, because we've been ignored so many times.
I mean, what it comes down to is that you don't feel seen, right? And that's huge, because how can you bring your most vulnerable state into a doctor's office only to be dismissed? So last week was actually Black Maternal Health Week, and I was digging into the literature for that, and the studies show that if a practitioner or a clinician does not see themselves in the patient that's in front of them, they're more likely to dismiss them. And so think about all the white clinicians that we've all been in front of, and then picture them looking at us, and we're dismissed more than half of the time. So I'm really ready to step into that role and just be present for women that I care about, and just to provide the care that they really need, for sure.
No, I'm so happy to hear that. I know when I would come to you weekly, we would discuss things like that, and we would talk about how I'm at the OBGYN, and I only had one white OBGYN, and it was like one white male, and the rest of the office was Black, Hispanic, and Middle Eastern women. And I was so hyped. But I remember you asking, like, you should go to Dr. Udo. What about Dr. Udo? And I was like, yeah, I'll go to her practice. But there was so many other women, especially of color. I had Dr. Gomez. I had, who else? Dr. Segal. Like, I had wonderful women of color.
Absolutely.
And then a whole woman birthed my little black baby, and I was just so happy. I was so happy because I was nervous. And don't get me wrong, because the one white male doctor who was there, who was working with me, was very attentive.
Great.
And so I was so surprised
Yeah.
at how attentive he was to my needs, and how I told him, well, I want to push this baby out. And he was like, and you will. He's like, you're going to push that girl out. You're going to be fine. Like, I'm here and we're going to take our time. Like, it wasn't like, oh, you need to hurry up. And he said, we're going to take our time and you're going to push this baby out and you're going to be fine. I was like, who are you?
That's beautiful. And it's sad to say that that story isn't heard enough.
Often.
It's not heard enough. I hear so many people that literally beg their doctors for a vaginal delivery, and the doctor's like, yeah, okay, we'll see what happens that day. And when the time comes, it's like, okay, well, I got 2 other women trying to be in labor the same time as you, so it's just going to be the odds, right? Whoever delivers at this time, if I'm in the room, great. If the nurse is in the room, so be it. But there's really no care. There's not the essence of putting the patient first. It's really about, well, I got things to do, right? I want to go home to be with my family.
And you're not the only patient I have.
Exactly.
And there's patients with worse conditions. And, we hear that a lot. We hear often like, okay, well, all right, well, I'll just send the nurse right back around and see what you need. I remember before giving birth, actually, I was so tired. I was in labor for 24 hours. I was so tired. I was so exhausted. And a woman, one of the nurses, she was like, oh, let's give you Benadryl to relax you. And I was like, no.
You trying to put me to sleep?
You trying to put me to sleep? I said, I'm going to wake up groggy, rude, and so's this baby.
Right.
And so they're like, oh, it's that her heart rate is dropping, so we're going to turn off all the medication and we're going to call it an emergency C-section. So they took me off of all the medications. And I looked at my mom. She was like, you better start praying. And I did. And they're like, we're just going to clear it with the surgeon first. And the head doctor. That doctor came in. She was a black woman. Chaza Wright Lugo. That was her name.
All right.
Okay.
Important enough that it stuck with you.
Important enough that it stuck with me. She sat by my side. She was like, you're going to push this baby out. And I was like, no, I'm tired. She was like, we're going to let you sleep, rest, do what you got to do, take your time. You're going to push this baby out.
Right.
And I was like, oh, all right. She was like, because she was like, if you want a C-section, she was like, it's not needed and it's not recommended. She was like, you need better healing time. She was like, you don't want all those cuts on you. She was like, and honestly, you don't need it. Right. She was like, I hear what they're saying, but I'm telling you, you're going to be all right. And I was like, all right, let's push this baby out. Let's push this baby out. Yes. And so I say that because I remember, like, we talked about when, like, Beyonce gave birth and Serena Williams gave birth, and how these women of color, of high status, of a different class than us,
right,
they got ignored. And if they got ignored, they would have possibly, dealt with an embolism. Like, right. That's what I keep hearing. Yep. Or heart complications and things like that. And it's just, how often, I'm asking this because how often do you see in your field more women of color or people of color in general get ignored when it comes to their health needs?
Every day.
Every day.
Single day.
That's not a once a while. This is an everyday.
This is an everyday thing. So the way it happens is that when patients come into my office, they usually start off with a little bit of paperwork, and I'm just humming around in the back, just taking inventory, just observing lightly. And so most of the time, just because of my age, my race, people don't think that I'm going to be the one to take them back for their evaluation. And so they observe me, but they think I'm like the office staff or something like that. Exactly. And so, they saw me in the beginning when they were filling out their paperwork, but then when I bring them back, I could see their eyes change and I could see their body language change. And they start telling their stories and I affirm them, and then I see their body language change that much more. And then at the end of our session, it usually ends with, I'm so glad that I get to be here.
Right.
I did not expect to have someone like you treating me. And that means all the world to me, because people are searching for people that actually care. But it's a shame that they have to work that hard to find the best practitioner for them. So one patient at a time, we're doing it. We're working towards it. So
that's the biggest focus. I know when I first met you, you were explaining to me in certain things that you specialize, but I was particularly shocked because I never heard of someone being specialized in pelvic floor therapy, especially for those who've been sexually assaulted, like trauma victims. Tell me about that. Talk about that. Like, educate me on that, because until I met you, I never heard of something like that.
Right. And so trauma is one of those things that people kind of throw around because it might be an emotional or a mental type of trauma, but also physical type of trauma. And I always tell people that it doesn't matter how your body experienced the trauma, because the body is going to hold on to it and create a story with it.
Right.
And so even though you might have had a trauma 10, 20, 30 years ago, the body holds on to it, right? It's like a child that keeps a blanket from infancy just because it's a wonderful keepsake or a wonderful memory. The body holds on to trauma in that same way. So it changes who you are. So sometimes people don't have to tell me that they're survivors of trauma or assault, but as soon as I put my hands on them, I can already sense it. Because people go into this guarded, closed-off position, and I can just tell.
You know, statistics show if you don't have sexual education classes and you're only teaching abstinence, well, it's a higher chance for teenage pregnancy, right?
Absolutely.
You know, versus teaching them, informing them, allowing them to make these decisions for themselves, then that would, you know, allow them to make better quality decisions, which potentially can adverse that of teen pregnancy. Right. So when I see things like that, I'm like, what do you mean you didn't have a sex ed class?
Right.
I've had sex ed since I was in the 5th grade.
Right.
And this is the suburbs, though.
Yep.
You know, it's a community 70% African American, but I received sexual education in the suburbs since I was in 5th grade.
Yeah.
And you know, I feel like for me particularly, it scared me. I was just like, I don't want to have sex. And to this day, I didn't have sex in my teens yet.
Right.
So I was so freaked out. I was so traumatized.
Yeah.
I don't think fear mongering is a good idea.
Not quite.
Not a good idea. But I was educated enough to know what STDs look like, STIs, just so many things. It gave me not an upper hand, but a better advantage.
Yeah, absolutely.
In knowledge, in my physical health. And then it gave me knowledge of knowing what a OBGYN is. And maybe you should go to the clinic when you're sexually active versus someone who's never had access to this class, never heard of it.
Right.
And not saying, you know, she's in her 20s now, married and everything, and not pregnant yet, you know. But she was able to avoid a possible issue at a young age.
Right.
So it's like when we have, I always say, because I feel like when we have information, we make better choices.
Of course.
So that's just sexual health. I feel like maybe people with the COVID vaccine, if they had better information, and it wasn't so fear-mongering, they would make better decisions.
Absolutely.
Even coming into this vaccine, whether they want to take it or not. Do we believe the myth that Black people don't get vaccinated?
That's a loaded question.
Talk to me. Say more.
All right. So I think there's some truth to it.
Okay.
And the reason for that is because I'm a Black person, and I had some suspicions about the vaccine early on.
Which we have the right to have.
Absolutely. Given the history of how Black people have been treated in this country when it comes to healthcare and experimentation on our bodies, there is natural doubt. And I don't want to dismiss whatever doubt that people of color do have when it comes to healthcare in this country, because it's all very valid.
Right.
But I think when people do things such as show Black people getting injected in the arm on TV constantly, it does something.
Ooh.
Right?
Triggering?
Very much so.
Okay.
I don't know if you recall, the first person that we saw on TV get vaccinated. Mm-hmm. Yeah, absolutely. And then there was a picture circulating of this Black woman with this needle in her arm. I think she was the first person in New York to get the vaccine. And it's just like, well, they're using us as scapegoats now, right?
Mm-hmm.
They're trying to speak to us by showing somebody of color on display, but it's so triggering to us as a people. And I think that just speaks a little bit to the truth of why we may not want to get the vaccine. So I'll be the first to admit I did not want to get that vaccine because I was super doubtful. But then I had to be the mature clinician that I am, research it, look into it, see what it is, how it differs from other vaccines, how it's similar to other vaccines. And the long and short of it is that even though this vaccine came about quite quickly in the past year, the way that they developed it has been worked on for a few decades now.
Okay.
So
can you say more on that?
I don't know all the specific details, but the way that they've developed this vaccine has been researched such that they were prepared for something like this even before coronavirus became a pandemic.
Okay.
Not to say that they were working on a coronavirus vaccine. That's false in and of itself, but the mechanism behind how they organized it and created it in the lab is not a new concept.
Okay.
So that was comforting to me. I'm like, okay, so you guys actually know what you're doing. I guess I can trust this vaccine. And I'm gonna be honest with you, I did get my vaccine back in January.
Awesome.
I didn't die. I have all my limbs.
You here, girl? I see you, baby.
And so, yeah, I'm nervous about what the future holds.
Okay.
Right? But I think we all are, because we're all experiencing this for the first time together.
Right.
And so just like the flu vaccine has to be distributed annually, it looks like we're going to have to do the same thing for this COVID vaccine.
Okay.
And I know a lot of people were alarmed by it, thinking like, oh, I thought this was supposed to be the end. Well, it's not the end, but that's okay, right? Because flu hasn't gone away just because we get vaccinated every year. So it's just going to be another one of those vaccines that we have to get boosters of. That's okay.
I mean, and it makes sense. I was researching, and basically the same thing you said. They were like, when it comes to the flu vaccine, the reason why you need a new booster every year is because new variants come out every year.
Absolutely.
And new variants come out because viruses evolve. Yeah. And they evolve because it spreads. So they mutate. I'm sorry, not evolve. Well, I can say either, but they mutate into something different, something stronger, possibly. So that is why you need an update every year. So I imagine, what you were saying, that they're gonna. Well, I mean, they've already said it. Yeah. You're gonna need a new booster every year. It kind of goes back to what we just said, the lack of education. Man, So I worked in healthcare since 2009, and then I focused in mental health, and then I came back to physical and mental now in 2019, November 2019. And I mostly work with elderly and disabled patients, right? I'm a service coordinator, and I'm making sure they're going to the doctor, making sure they're on top of things, they're taking their medication. But what I mostly do is coordinate services to make sure that they're well taken care of at home. Right. That, they need things at home to help them assist, to mobilize, things as such. That's where my focus is right now. And the majority of my participants are Black and Hispanic. Yeah. Right. And so I have to do my calls like, hey, did you get the the COVID vaccine? And you got some old Mr. Smith or John Doe or whatever. Right. I ain't getting that vaccine. I'll be like, all right, okay. And it's that factor. It's the no, I know what they did to us back then when it comes to Tuskegee Airmen. And people are like, well, they didn't know they were getting injected with this. And so this man whose grandfather was getting experimented on with syphilis, I had it in my head that it was something horrid of a scene. And I found out it wasn't.
Yeah.
That a nurse would come, or they would get dropped off at like a rec center, and they would meet up with other black males. They would talk, they would eat, they would play games. So it was such a nice ambiance.
Yeah.
But it was almost like a distraction.
Absolutely.
To keep them distraction of what was really happening underneath. And then what I found out was that they paid each of them $38,000 in order to do this to them without telling them, but gave them this, like, hey, we just, they thought they were just getting shots like vitamins and things like that.
Yep.
And so
for 40 years.
For 40.
Yeah, let's.
40 years.
Isn't that wild? And it's funny because we were kind of talking about that offline a little bit earlier, where, institutions will do as much as they can to keep you comfortable, but once you start to like peek out from over the covers to see what's going on around you, they want to shush you up a little bit, right? They just want enough so that you stay focused on what's in front of you, but not necessarily enough to have you better yourself. And that's a problem. And so when I was researching the COVID vaccine, I actually happened to go on Johns Hopkins website. And I don't know if you recall, but Johns Hopkins, that's the institution that basically stole Henrietta Lacks's
DNA.
Yep, her cells to do God knows what with it. And it's so funny because they know that they've been outed at this point. So on their homepage, they pay homage to her. It's a beautiful image with lights of colors in the background, making it look as though she consented. You can't honor someone after you've humiliated them, after you've disgraced them, and after you've made them less than human. But that seems to be a trend in our culture and in our society today, where we're just like, okay, whatever keeps you happy, but we'll still refer to you as less than human when you're not in front of our presence, which is quite a shame.